Hello, my name's Tania Jones and I will be performing a neurological exam on a patient. Before I walk in and see the patient, I would wash my hands and do a little research on the patient, and then I'll go walk in. Hi, my name is Tania. I'll be your nurse today. What's your name?
My name is Allison. Nice to meet you.
Hi, nice to meet you, Allison. Before I start, I'm going to be performing a neurological exam on you. It shouldn't hurt. Do you have any history of anything neurologically going on?
Not neurologically, no.
Okay, perfect. I'm going to start off with the 12 cranial nerves, okay? And I'm going to start with cranial nerve 1, which is the olfactory, which is smell. So I'm going to need you to close your eyes, and I'm going to put a smell on around your nose, and you tell me what you smell.
Smells good. Peppermint?
Peppermint, yes.
Peppermint.
So it is peppermint, and so we would normally want to do something that's familiar around every culture. So she got that right. You can open your eyes. The second is cranial nerve 2, which will be more of pupillary response and then also peripheral vision. So I'm going to be looking at your eyes with this pen light, okay? Just keep focus on there, and then I will shed a light. Perfect. Nice. Nice. Perfect. So they're brisk at a 3, round and equal. No issues there. And now I'm going to be doing the peripheral vision part of this exam. So if you don't mind standing up really quick. So you can face me. So you're going to cover your left eye. I'm going to cover my right eye. Okay. And then can you see my fingers? Oh, look at me. Can you see my fingers?
Yes.
Yes. Okay.
Yes.
Okay. So we're going to put our hand down, and then we're going to do the opposite. Okay. Okay. You see my fingers?
Yes. Yes. Yes.
Okay, perfect. So that's it. That was just more of the peripheral vision, right? And then we're going to look now at cranial nerves 3, 4, and 6. So you can have a seat. Now I'm going to have you look at my finger, okay? And I'm going to have you follow my finger, okay, without moving your face up and down, just your eyes, okay? Okay. So what I'm looking for there is for nystagmus, and that's of the eyes, and you can stop. Looking at the eyes to see if they're moving side to side, and the cranial nerves are looking when I go up and when you look down and side to side, and I did not see any nystagmus, so that's a normal exam for her. The cranial nerve 5, I'm going to have you close your eyes, and as a little sensory component, do you feel my fingers? Okay, and then I'm going to have you clench your jaw, okay, and I can test for the TMJ, which I feel a little bit over here, some TMJ going on here. You can open your eyes. You have a little TMJ, a little bit. You can see it when you clench your jaw a little bit on that side. Okay, so now I'm going to move on to cranial nerve 7, which I'm going to have you smile. Nice. Now I'm going to have you puff your cheeks like that. Perfect. So that looks normal and symmetrical. And then tight. Close your eyes really tight, and don't let me open. Perfect. So all normal and good. Then I'm going to test cranial nerve 8, which is the acoustic nerve. So I'm going to have you close your eyes. I'm going to whisper a word on each side, and you let me know what I'm saying, okay? House. Okay. Pencil. Okay, perfect. So she passed that exam. She can hear the whisper test. If she did not, then I would have done moved on to the Weber Rhine exam. Now I'm going to do cranial nerve 9, which is rise and fall of the palate. So I would have her say ah, and then I'll look at her palate. Ah, ah, say ah. Okay, which is good and normal and symmetrical. The next one, cranial nerve 10, is gag and swallow. I'm not gonna gag her, but that's what I would test next, is the gag reflex. Cranial nerve 11 is I'm gonna push down on your shoulders and you raise your shoulders up. Okay, perfect. So she's pretty strong there and symmetrical. And then cranial nerve 12 is your tongue out, and I'm looking for midline, which looks midline to me. So those are all the cranial nerves 1 through 12. Next, I'm going to do the tendons, and I would do them on both sides. I'm going to do the tricep, and so I would need you to relax as much as you can, okay? I'm gonna grab, and you just relax, right, just like a rag doll. And I'm gonna hit right over here to test for the tricep. Oh, there we go, little reflex there. Then I'm going to move towards the bicep, just right here. Nice and relaxed. Nice, good. Then I'm gonna hit my finger. Yep, she has a nice reflex there. I can feel it. Then we're going to move over to the brachioradialis, which I'm gonna hold here. And then I'm gonna hit right here near the forearm. Yep, nice and good and strong. Not too painful, right? Okay. Then I'm going to do in the abdominal one, I would have her, I won't do it now, but I would have her start from with like a cotton swab, go or a cotton tip, start from here up in the epigastric area and go down to her umbilicus, and see a contraction of her abdominal muscles, and that would be a response to that tendon, and that's the abdominal reflex. But I'm not obviously going to have you exposed and show your abdomen. The next one is the patellar, which I will see if I can do it here with your leg hanging. Oh, there you go. So it hit down a little bit down on, you can see the foot move a little bit. So that's patellar. Then I would want to do the ankle, and that one I'm going to have you stand and go more like you're sitting on your knee. On the chair, put one knee up like that, but the other way, so I can reach your ankle. Perfect. Okay, so then I'm going to hit around the ankle area and see a reflex. There we go. So that was the ankle reflex, which is perfectly normal. So all of her reflexes are good, and I should have a +2 response on both sides. So I would have done that bilaterally. Next, I'm going to look at her plantar response, which she has her, you can go ahead and sit down. She has shoes, but what I'm looking at there is the Babinski. So we're looking at the bottom of her foot, and it's a candy cane or an upside down J. So what I would have done is gone up with something, with the hammer, go up her foot, and the normal response is to have her toes grip down. And the negative or negative result, our normal result would have her toes flaying out. So that's what that test would have showed me on you. The next exam is called stereognosis, and I'm going to have you close your eyes, and I'm going to put an object in your hand, and I'm going to have you tell me what is it.
Key.
Okay, perfect. You can open your eyes. So this is a key, right? So you pass that exam. The next exam is called graphthesia, and I'm going to draw a number. So close your eyes. I'm going to draw a number on your hand, and just tell me what number that is.
6, 2.
2. So she got it right on the second time. So it is a 2, which is great, and that's what we want to see for that exam. Now I'm going to try the position sense. I'm going to grab your hand and you're gonna close your eyes and you're gonna tell me what position I'm moving your finger, okay?
Up, down, up, side,
Which
right,
side?
right,
Right side.
left, right, up, down.
Perfect. So she passed that exam. She's telling me exactly what coordination or where her fingers are moving. Next, I'm going to do a few minutes if I can see you walking. I just want to see your gait, your steadiness. Perfect. Then you can come back down. Okay, perfect. So right there, can you do, can you show me a little bit of walking from on your tippy toes? And you can walk down a little bit too. Perfect. Can you come back with your heel walking? Can you walk on your heels? Perfect. And then the next step that I would like to see, walk on toes, walk on heels, heel to heel. I want you to just do a little bit of heel to heel walking like this, touching your heels. Perfect. So that is steady gait, symmetrical, normal. The next step is going to be the Romberg exam. So I'm gonna have you just stand right there and I'm gonna have you just close your eyes. For 60 seconds is the exam. And what we're testing here is for this cerebellar and stability and balance. So I would want to make sure that I'm close by just in case you start swaying back and forth or side to side or front and back, which she looks like there's nothing. If you can raise your hands up, straight up, both of them in front of me. Perfect. Right down in the middle. Okay, and don't let me move. Yeah, nice. Perfect. So no issues there. You can open your eyes. No issues there with balance. My next exam, you can have a seat. If you can do heel to shin. So heel to shin down and then perfect. And then my next exam will be finger to nose. So I'm going to have you touch your finger to your nose and then touch my finger. Okay, do that back and forth. Yep. Okay. Nice. Try the other hand now. Perfect. Nice. So she did that nice and good. Then I'm going to do the rapid alternative movements. So I'm going to have you put your hand up like this, and then you're going to go back and forth like this, like almost like patty cake. Okay. Perfect. And then I'm going to have you touch your thumbs with different fingers. Perfect. Okay. And that's the rapid alternative movements. Then our last exam that I want to do is I'm going to see if I touch, if you close your eyes, if you can tell me if it's, and you might, are you okay if you take your jacket off? I'm going to ask you if a sensation is sharp or if it's dull. Okay. With you closing your eyes. Perfect.
Sharp, 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 dull, dull, sharp, sharp, dull, sharp, sharp.
Okay, perfect. I would continue the test if she had a gown on, so I can do her thighs and stuff. But that was a little either the sharp or dull, so your sensations are good. I believe that concludes, and I would do that all bilaterally. I think that concludes all of our exam today. Did you have any questions?
No.
No, everything's good.
Good.
Well, everything was really good for us. I think we're done for the day. If you have any further questions, let me know. If not, I thank you for your time and allow me to perform the exam.
Thank you.
All right, thank you.